The information you will listen to in this video has been prepared by making use of the package insert of the drug. If the video was useful for you, don't forget to like the video and subscribe to the channel. Terazol belongs to a class of drugs called antifungals, vaginal. The active ingredient of Terazol cream is terconazole. What is Terazol 7 cream? What is it used for? This medication is used to treat vaginal yeast infections. Terconazole reduces vaginal burning, itching, and discharge that may occur with this condition. It works by stopping the growth of yeast that causes the infection. How to use Terazol 7 cream. This product is for vaginal use only. Wash your hands before and after use. Avoid contact with your eyes. If it gets into your eyes, wash them right away with plenty of water. Call your doctor if eye irritation persists. Use this product usually once daily at bedtime for 3 or 7 days or as directed by your doctor. The dosage and length of treatment is based on your medical condition and response to treatment. Wash your hands before and after using this medicine. The vaginal cream comes in a tube. You will use an applicator to put the cream into your vagina. The applicator is an empty plastic tube called a barrel. There is a plunger on one end and an opening on the other end. Remove the cap from the end of the tube. Screw the open end of the applicator onto the tube of cream. Squeeze the tube and fill the applicator until it is full or the plunger stops. Unscrew the applicator from the tube and replace the cap on the tube. To use the applicator, lie on your back with your knees drawn up toward your chest. Hold the applicator by the open end of the barrel and gently insert it into the vagina as far as it will comfortably go. Slowly press the plunger of the applicator to release the cream into the vagina, and then gently remove it. After using, pull the plunger completely out of the applicator and wash both pieces with lukewarm, soapy water, and dry thoroughly. If the medicine comes with disposable applicators, use each applicator only once, and then throw it away. Continue to use this medication every day until the full prescribed amount is finished, even if symptoms disappear after 1 to 2 days. Stopping the medication too soon may allow the yeast to continue to grow, which may result in a return of the infection. You may use this product during your menstrual period. Do not use tampons or douches while using this medication. Unscented sanitary napkins may be used for your menstrual period or to protect your clothing from leakage of the medication. Do not give this medication to anyone under 18 years old without medical advice. Things to know before using Terazol 7 cream are as follows. Before using this medication, tell your doctor or pharmacist if you are allergic to it, or to other azole antifungal agents, or if you have any other allergies. Before having surgery, tell your doctor or dentist about all the products you use. Ask your doctor whether you can have sexual intercourse while using this product. The suppository may damage rubber products and lead to failure. This can result in pregnancy. Do not use these products during treatment with the suppository form and for 3 days after treatment is over. During pregnancy, this medication should be used only when clearly needed. Discuss the risks and benefits with your doctor. What are the side effects of Terazol 7 cream? Common side effects of Terazol May 7 include headache, body pain, vaginal pain, burning, or itching, stomach pain, or increased menstrual cramps. If this video was useful for you, please like the video and subscribe to the channel for support. Share your views and experiences in the comments section. I wish you healthy days.